Prime Minister Narendra Modi welcomes RBI's announcements on policy rates, says the move will improve liquidity, reduce cost of funds, help middle class and businesses. Finance Minister Nirmala Sitharaman appreciates RBI for the well-timed decision, says slashed interest rates need quick transmission. Big relief for economy. RBI announces 3.74 lakh crore liquidity for the banking system. Suggests banks to give relief on EMI for 3 months. Number of active cases of COVID-19 in the country has increased to 640. 66 people have so far been discharged from hospitals after treatment. 17 people have died. Odisha to build the largest hospital dedicated to COVID-19 patients. Delhi Chief Minister Arvind Kejriwal says there is adequate arrangement in Delhi for treatment of COVID-19 patients. Lunch and dinner will be provided in 325 schools for around 500 people. Assures no one will be left hungry. Central government issues guidelines to maintain the availability of essential commodities. Ministry of Home Affairs instructs chief secretaries of all states to facilitate home delivery, e-commerce and supply of essential goods. Global death toll from COVID-19 has crossed 21,000, with more than 4.5 lakh people infected with the virus. COVID-19 cases in the US surpasses the toll of China. Hello, you're watching DD News and I'm Preeti presenting the bulletin. Our top story first. Prime Minister Narendra Modi took to Twitter hailing RBI's move. The Prime Minister said that today RBI has taken giant steps to safeguard our economy from the impact of coronavirus. He said that the announcements will improve liquidity, reduce the cost of funds, help middle class and businesses. Along with a tweet, Prime Minister also shared a link to access the full announcement. Finance Minister Nirmala Sitharaman also appreciated RBI Governor's reassuring words on financial stability. The Finance Minister opined that the measures announced by the Reserve Bank of India gave the much desired relief. Sitharaman hoped that the slashed interest rate gets a quick transmission and welcomed the RBI Governor's statement on India's economy being sound and stronger than the aftermath of the 2008-2009 financial crisis. The Reserve Bank of India today cut the repo rate by 75 basis points to 4.4% versus 5.15% earlier. The Monetary Policy Committee advanced its meet to March 24, 26 and 27 and voted by 4:2 majority to reduce the policy repo rate. It has been decided to reduce the cash reserve ratio or the CRR of all the banks by 100 basis points to 3% of the net demand and time liabilities with effect from the fortnight beginning March 28th for a period of 1 year. The RBI governor said that COVID-19 stalks the global economy and the outlook is highly uncertain and negative. Several nations are battling this exponential contagion. Countries are shutting down to prevent being sucked into a kind of black hole. India has locked down economic activity and financial markets are under severe stress. Finance is the lifeline of the economy. Keeping it flowing is the paramount objective of the Reserve Bank of India at this point of time.
Rate cut decision is 75 basis points and accordingly the repo rate stands reduced from 5.15% to 4.4%. Simultaneously, the fixed rate reverse repo rate, which sets the floor of the liquidity adjustment facility, that is the LAF corridor, was reduced by 90 basis points. I repeat, 90 basis points to 4%, thus creating an asymmetrical corridor.
In another announcement, the governor has also announced that major lending institutions are being permitted to allow a moratorium of 3 months on repayment of installments for term loans outstanding as on March 1st, 2020. The moratorium on deferment of payment of term loans will not lead to asset classification downgrade.
All commercial banks, including regional rural banks, small finance banks and local area banks, cooperative banks, all India financial institutions and NBFCs, including housing finance companies and microfinance institutions, that is all lending institutions basically in the system. All the lending institutions are being permitted to allow a moratorium of 3 months on payment of installments in respect of all term loans outstanding as on 1st March 2020.
And Shama Mishra is joining us on phone line. Shama, this was the need of the hour, as has been put forth by the finance minister. The move which the RBI has taken, cutting the rates, how far will it help the common man?
Oh, well, yes, this decision, apart from helping the common man in the financial matters, it also gives us
decision is
authority
75 basis points,
to the
and
common person who is struggling, in the time of COVID-19. After the Reserve Bank of India reduced the 75 basis point from the repo rate, this means that during the lockdown it will not be of much help to people. But yes, if the floating rates on the home loans, those who are having floating rates on the home loans, that will benefit them. And apart from that, he also mentioned the moratorium of 3 months for the outstanding term loans. And this will definitely help people, because the repayment for the loans that they are currently asked to do for the next 3 months, that money they would be having for themselves in this difficult time, and they can spend it on the necessary requirements. Apart from this, also he did mention that for the liquidity enhancement and to ensure that there is enough liquidity in the markets, he did mention that time and again they have taken decisions and they have taken measures, and also when it is required in near future also they would be keeping a close watch on the entire situation. He also came up with a statement that conventional or non-conventional, all measures would be taken to ensure there is financial stability. 19 has hit not just the entire lifestyle but the markets as well. The governor Shaktikanta Das, he did mention that global recession is there when we look forward, and to have a support to shield our economy, these measures are very important, and that is why he mentioned all these points. And he also mentioned whatever measures are required in the future, that will also be taken. So yes, the key takeaway from this is the repo rate has been reduced, the 3 months moratorium, also 100 basis points reduction on the CRR, because the banks will also be having some funds with themselves, and that will ensure the stability of funds with the banks, with the private sector banks as well. Most importantly, the governor has highlighted that the fundamentals of our economy is stronger, and the Indian banking system is safe and sound, and there is no need for panic withdrawal. So when we saw that after the announcement of lockdown came, people were rushing to ATMs to withdraw their cash. So a very reassuring statement is coming out from the central government, central bank chief, that there is no need for panic withdrawal. The money is safe, and as and when the refilling of the ATMs is required, it will be done on timely basis. So money would be there in the ATMs. There is no need for panic withdrawal. And yes, the economy currently stands stronger.
All right, Shama. Yes, the reassuring words there by the RBI governor. Thank you so much for joining us with those inputs. And to talk more about that, our correspondent Ajay Mishra is joining us. Ajay, we talked with Shama as to how important are these measures which were announced by the RBI. Added to that, what do you make of the assurance which has been put forth by the RBI governor when he says that there is no need for panic withdrawal and the banking system in the country is safe? What do you make of these? How important is this reassurance coming in at this time of crisis?
So I think it's very important on part of RBI to actually assure the whole economy that the banking system is quite safe and sound. And the DFS, Department of Financial Services, have also appealed people not to panic and go for panic withdrawals. And they've also appealed everyone to not pay heed to the rumors that banks branches are going to close down or ATMs are going to run short of any kind of cash. So though under the essential services, all the banking activities had been put under by the Ministry of Home Affairs, and it has been assured from all quarters within the RBI and the Finance Ministry that the people at large will not be facing any kind of problems when it comes to the daily cash transactions via their ATMs and some special banking services from their respective branches. So there is nothing to panic about, and this is the biggest news out of today's RBI meeting, that the financial system is at the sound and a very safe level, and in fact better than the 2008 financial crisis. So it's very soothing and heartening to listen it from none other than the RBI governor.
All right, Ajay, thank you so much for joining us with those inputs. So that was about the announcements which have been made by the RBI governor. Also, the centre has asked state governments to deploy additional medical facilities and fiscal resources for fighting COVID-19. A look at the latest data regarding spread of coronavirus in India shows the total number of active cases of COVID-19 has risen to 640. 17 deaths have been reported due to COVID-19, while 66 people undergoing treatment have been cured and discharged from hospitals. The highest number of cases have been reported from Maharashtra and Kerala. And amid the COVID-19 outbreak in the country, Odisha government has taken the first-hand initiative to set up a largest COVID-19 hospital in India. This establishment will consist of about 1,000 beds and will be functional in a period of 2 weeks. Odisha will be the first state in the country to set up such a large-scale hospital exclusively to treat COVID-19 patients once this hospital is established. The Kalinga Institute of Medical Sciences has signed a memorandum of understanding with the Odisha government to set up a special hospital to combat the spread of novel coronavirus in the state. The centre has restricted sale and distribution of sand to meet the requirements of emergency arising due to the pandemic. Now, according to a Gazette notification issued by the Union Health Ministry, the sale of the drug from now on should be in accordance with the conditions for sale of drugs specified in Schedule H1 to the Drugs and Cosmetics Rules 1945. In the order, the government declared that the central government is satisfied that the drug Hydroxychloroquine is essential to meet the requirements of emergency arising due to the pandemic, that is COVID-19, and in the public interest, it is necessary and expedient to regulate and restrict the sale and distribution of the drug hydroxychloroquine and the preparation based thereon for preventing the misuse. The centre has issued a notification advising all state governments to ensure home delivery of medicines from the pharmacies. The Union Health Minister, Dr. Harshvardhan, has advised all states to start a helpline for patients living in quarantine to take care of the mental health of such patients. The minister informed that telemedicine guidelines have been issued and an app is being started for the same. Dr. Harshvardhan asked the states to identify those doctors who would use the app to advise the people living at home. And Delhi Chief Minister Arvind Kejriwal today briefed media on the preparation on COVID-19. He said that the government has sufficient arrangements to tackle 100 COVID-19 cases daily. He said that the state government will provide food to around 2 lakh people from today.
डॉक्टर सरीन जो कि ILBS के हेड हैं, उनकी अध्यक्षता में उन डॉक्टर्स की टीम ने बहुत शानदार काम किया है. उन्होंने कल अपनी रिपोर्ट दी है सारी तैयारियों का प्लान बना के कि आने वाले समय में अगर कोरोना के केस बहुत ज़्यादा बढ़ गए दिल्ली के अंदर तो हमें क्या क्या तैयारियां करनी है. 100 से जैसे ही बढ़ते हैं तो इन्होंने प्लानिंग करके दी है कि हमें 100 से बढ़ने पे इन अस्पतालों के अंदर और तैयारियां करनी है. ये प्राइवेट अस्पताल को हमें इंक्लूड करना है, ये एम्बुलेंसेज यहाँ से आएंगी, ये वेंटिलेटर यहाँ से आएंगी, तो 100 से बढ़ते ही फिर हम वो सारी चीज़ें इम्प्लीमेंट करना चालू करेंगे। एक तरह से SOP तैयार हो गया हमारा, एक तरह से पूरी प्लानिंग तैयार हो गई। 100 से बढ़ने पे हमें ये स्टेप्स लेने हैं।
With a nationwide lockdown in effect till 3 weeks, people have come up with innovative ideas amidst the quarantine sessions. In Ludhiana, police has distributed food to the needy as the lockdown entered day 3. Also in Uttar Pradesh, police personnel in Prayagraj deployed at Civil Lines Police Station prepared food for the needy and distributed among them amid lockdown in the wake of coronavirus outbreak. Meanwhile, in Maharashtra, as Navratri festival is being observed nationwide, people observe Aarti at Mumba Devi Temple in Mumbai. Keeping in mind the norm of social distancing, devotees gathered outside the temple to see the Aarti being performed by priests through a television, as the entry for devotees has been restricted due to the 21-day lockdown. On the other side, in Kolkata, roads remain deserted amidst the nationwide lockdown for 21 days. Bhargav is joining us from Ahmedabad to get us more on the lockdown. Bhargav, we are showing positive stories of how people are coping with the situation when we talk of COVID-19 and the lockdown for 21 days. You're there in Ahmedabad. Let us know how is the day going on there.
जी, खास करके आज सुबह से ही आज तीसरा दिन है लॉकडाउन का, तीसरा दिन यहाँ है। तो अहमदाबाद में आज सुबह से ही पूरा एरिया, यहाँ जो ये मुख्य बाज़ार है अहमदाबाद का, पूरा मुख्य बाज़ार है, माधोपुरा गंज बाज़ार है, वहाँ पूरा आज कोई पल भी नहीं मार सकता। यहाँ पे पूरा बंद है। पुलिस भी आज यहाँ खूब सतर्कता से यहाँ गाड़ी यहाँ पर जो काम कर रही है, और लॉकडाउन का अमल से आज सुबह में RF की 3 टुकड़ी भी यहाँ उतारी गई थी। तो उसकी वजह से दूरदर्शन भी लोगों को बोल रहे हैं कि घर पे रहो, स्वस्थ रहो और सलामत रहो। जी,
Yes, stay safe and stay at home is the best precaution one can follow. Thank you so much, Bhargav, for joining us with that update from Ahmedabad. And in their bid to generate awareness about coronavirus, the public broadcaster of India, DD News, produced a video regarding the fate of coronavirus outbreak globally. Let's take a look. And when we talk of awareness, the best precaution one can practice is social distancing and isolation. Keep yourself safe, keep washing your hands time and again with soap and water, and keep sanitizers handy. These are the precautions which you can follow when we talk of the situation arising out of COVID-19. We'll get to this report. And today is the third day of the lockdown. The lockdown was announced by Prime Minister, and that was a 21-day lockdown. And here in the visuals, we show you how the coronavirus has spread its fangs throughout the world. And here we have the figures of Italy on your screens. 8,215 deaths have been reported. And up next is the data for USA. 1,201 deaths have been reported from USA. Different countries are coping up with the crisis at this point in time, and on your screens we're showing the different countries with their cases and number of deaths through COVID-19. The global death toll from COVID-19 has crossed 21,000, and even as we speak, more than 4.5 lakh people have been infected with the virus across the world. The COVID-19 cases in the US has surpassed the toll of China. 1,201 cases have been reported from US. Just a while back we showed you, and the Prime Minister gave a clarion call for firstly a Janta curfew, which was practiced on 22nd of March, and then the Prime Minister in the address to the nation, he announced a lockdown for 21 days. And here on your screens we have deserted roads, deserted malls, shops are closed, people are following the lockdown, and isolation and social distancing are the two most practical precautions that can be practiced to keep coronavirus, that is COVID-19, at bay. Yes, keep yourself aware, stay indoors, keep yourself safe. The mosques across the country have asked the people to follow the prohibitory orders imposed to check the spread of coronavirus and offer prayers at home. Most of the mosques have put signboards at their gates requesting people to offer prayers at home during the lockdown, especially on Friday.
पूरी दुनिया आज एक आजमाइश के दौर से गुजर रही है और कोरोना वायरस हिंदुस्तान ही नहीं बल्कि पूरी दुनिया में मुहलिक बीमारी की शक्ल इख्तियार कर चुका है और इसमें ज़रूरी है सबसे ज़्यादा एहतियात, प्रिकॉशंस, और गवर्नमेंट ने जो स्टेप लिए हैं उस पर ज़्यादा से ज़्यादा अमल करना। और जुमे में भी ख़ास तौर से हमें इस बात का ख्याल रखना है कि हम मसाजिद में जमा ना हों। हिंदुस्तान के अक्सर उलमा ने भी फतवे दिए हैं, अपनी राय दी है कि लोग अपने अपने घरों में ज़ोहर की नमाज अदा करें। मसाजिद में सिर्फ 5 लोग जुमे की नमाज अदा करें, शरअन इसकी इजाज़त है।
And now robots will serve the patients of COVID-19 hospitals. Yes, it is difficult to believe, but it is true. Jaipur's SMS hospital has come up with a unique idea to use robots to serve food and medicine to the patients of coronavirus. The step has been taken by the administration and donors together to safeguard health workers and medical staff against this contagious disease. Hospital Superintendent Dr. D.S. Meena has informed that NOC has been given to engage 3 robots for the same, out of which one has even started coming to the hospital. The demonstration of this robot has begun at isolation wards, while the medical staff has to wear the PP kit each time they go near a patient. It does not fully cut the risk of getting infected. However, the robot is hence being seen as a measure to ensure complete isolation for the COVID-19 patients. In a battle against the novel coronavirus, the Indian Army is also playing a major role. It has codenamed its anti-COVID-19 operation as Operation Namaste to combat the spread of coronavirus pandemic in the country. Army Chief General M.M. Narvane said that it is the responsibility of forces to help the government in the fight against COVID-19, while the Army has also issued advisories to keep the personnel safe and fit.